Travel warnings have been issued for Guinea, Liberia, and Sierra Leone.
LUTV's Brianna Miller is in the studio to tell us what precautions Missouri hospitals are taking to prepare for Ebola.
Texan citizens are questioning how another nurse could have been exposed to the virus if all safety measures were met. The staff at St. Joseph Health Center in St. Charles tells us how they plan on containing an outbreak. Dr. Shephali Wulff is an infectious disease consultant at St. Joseph Health Center. She says the hospital has a place for suspected cases of Ebola when evaluating patients.
The triage nurses have been directed to isolate that patient immediately, so those patients would go into a private room with their own bathroom. They would be placed on what we call droplet and contact isolation. Most patients, we believe, will be placed in airborne isolation.
The virus holds an incubation period of 21 days before visible symptoms appear. There has only been one death in the United States of Ebola so far, but you can never be too cautious. The symptoms are nausea and vomiting, diarrhea, raised rash, red eyes, stomach pain, chest pain and coughing, red eyes, and bleeding and bruising. Keeley Hayes is the Administrative Director of Nursing Operations. She says that all nurses are directed to immediately put on their safety gear when Ebola signs are present.
We isolate them right away and start our testing process, and then immediately use our PPE, which is our personal protective equipment, to keep ourselves safe, to keep that patient safe, and to keep other patients in the emergency department safe.
Wulff says that the hospital is taking the safety precautions seriously.
There have been a lot of meetings at the hospital and across the network about Ebola virus preparation, and there are a number of steps that we've taken. So there's been a tremendous amount of education for the hospital staff, the administration, nursing, triage about the symptoms of Ebola.
Early symptoms of the virus take 8 to 9 days to show after exposure. Tests for antibodies against Ebola and viral DNA help doctors make a diagnosis. For LUTV News, I'm Brianna Miller.